Robert Morris University's School of Nursing and Health Sciences is pleased to present an interprofessional standardized patient simulation video depicting a patient presenting to the primary care setting for a driver's license physical examination who is found to be engaging in self-injury. The following video has been developed to highlight interprofessional collaboration when treating patients with comorbid physical and mental health diagnoses. Critical thinking and reflection questions to consider when viewing the video include: if this was your patient, what would you have done differently? What physical examination techniques were implemented? Was any part of the physical exam omitted? What history is necessary when assessing a patient for a driver's license physical? What are risk factors for self-injurious behavior? What psychiatric diagnoses are commonly associated with self-injurious behavior? What is the relationship between self-injurious behavior and suicide? Why are adolescents vulnerable to self-injurious behavior? What are the etiologies of self-injurious behavior? What are the non-pharmacologic and pharmacologic treatments for self-injurious behavior? And finally, what was your impression of the interprofessional collaboration between the physician and psychiatric mental health nurse practitioner?
Hi, Miss Lewis.
Hi.
I'm Dr. Hellier. Hi, I understand you're here for a driver's license physical.
Yes.
All right, very good. How old are you?
16.
16, huh? Are you allergic to anything?
No.
Okay, very good. Are you taking any medicines currently?
Mm-mm. Oh, well, I take Yaz every day, my birth control.
Okay, sure, oral contraceptive. All right, very good. Do you have any medical problems? Diabetes, high blood pressure, any unusual childhood illnesses?
No.
Okay. Specifically, have you ever been told that you had a seizure disorder or epilepsy, or have you had episodes of passing out?
No.
Okay, very good. How have you been lately? Have you been well? Had a cold, vomiting, diarrhea, abdominal pain, irregular periods, pregnancy, anything at all medically going on with you?
No.
All right. Well, very good. Let me take a look at you here. I want you to look up a little bit. Okay, good. Now I'm going to want you to follow my finger with your eyes. Look over there, up, down, over here now, up, down. Shrug your shoulders up. Grit your teeth for me. Hold your hands out and grab my fingers. Okay, very good. Push out. All right, I'm going to listen to your heart. Oh, that's very nice, no murmurs. Let me check your pulses here. Let me see. What's going on with all this?
I've been cutting myself a little bit.
When did that start?
A couple months ago.
Have you ever been seen or treated for that in the past?
No.
No? Okay. Have you done anything to harm yourself in another fashion, taken an overdose of pills or hurt yourself in some other way? Anything like that?
No.
Okay. Well, what we're going to do is I'm going to ask our medical assistant to do a depression screening exam for you. And also we're going to have Dr. Koenig, our mental health nurse practitioner, come in and talk to you and see what we can do to help you with that.
Okay.
All right, very good.
Thank you.
Oh, yeah.
Hello, hi Sierra. I'm Kirsten Koenig. I'm a psychiatric mental health nurse practitioner. Dr. Hellier wanted me to talk with you today. Do you mind if I take a few minutes to talk with you?
That's fine.
Okay, it's nice to meet you.
Nice to meet you.
Okay, I just wanted to start with getting to know you a little bit. So you are 16 and you're here for a driver's license exam, correct?
Yes.
Okay. But Dr. Hellier had expressed some concern that you have been cutting and wanted me to talk to you a little bit about that. So can you tell me a little bit about your mood lately, how your mood's been?
I don't know. I've felt a little overwhelmed and stressed out lately.
Okay. What's going on with you in your life that's making you feel overwhelmed right now?
My mom's been working a lot, so now I have to watch my younger brother and sister more than I used to have to.
Okay, so you have to watch them over the summer. Okay, so that's something that's stressing you out. Is there anything else going on in your life right now that's making you feel overwhelmed?
Well, my boyfriend and I just broke up, and I've been having problems with my friends, so yeah.
Okay, when did you and your boyfriend break up?
Probably about 2 months ago.
Okay, so it's been a hard 2 months. Okay, all right. So would you say your mood's been more depressed lately?
Kind of, yeah.
Okay. If I would ask you, Sierra, to rate your depression, because this helps me, on a scale of 1 to 10, with 1, your mood's really good, and 10, it's very depressed, not wanting to be alive, what would you say you've been lately?
Maybe like a 6.
Okay, okay. How about, have you recently, with feeling more overwhelmed, had any problems with sleeping?
Yeah, it's been hard for me to fall asleep.
Okay. How long does it usually take you to fall asleep?
Probably about like an hour now.
Okay. When you're laying there, is it that you're thinking a lot at night that's causing you not to be able to fall asleep?
Yeah.
Okay. All right. Has there been any changes in your appetite recently?
I haven't really been as hungry lately.
Okay. All right. Have you lost any weight?
No.
Okay. With the changes in your appetite, are you trying, I know you said you haven't lost weight, but are you concerned at all about your body image or trying to not eat to lose weight?
No.
No, you just haven't been as hungry. Okay. All right. How about, I know we just finished the school year, so how were your grades this last quarter?
They were okay, not as good as they usually are.
Okay, so what's okay? What were they?
B's and C's.
Okay, so your grades have lowered a little bit too. Okay. How about interests, things you normally enjoy doing? How have you been with those type of things, like going out with your friends or watching movies or whatever it is you like to do? How have you felt your interest level has been?
Not as good as it usually is. I used to play the clarinet, but I'm not really interested in that anymore.
Okay, so you've seen a change in that. So we have that your mood's been lower and that you're having more difficulty with sleep at night and not eating as much and loss of interest, correct? Okay. With this change in your mood and the breakup in the relationship, have you had any type of suicidal thoughts?
No.
Okay, so the cutting that you're currently engaging in is not an attempt to kill yourself?
No.
No, okay. Do you ever have thoughts, Sierra, that you just wish you were dead?
Sometimes.
Okay, okay. How do you handle that when you have those type of thoughts?
That's when I usually cut myself. It makes me calm down a little bit.
Okay, all right. So the cutting helps calm you. Okay, so when did the cutting start?
Around when my boyfriend and I broke up,
Okay.
so 2 months ago.
Okay, so the mood and the cutting all started after the end of this relationship. So this has been really difficult for you. How often would you say that you're engaging in the cutting? Like, is it daily or is it...
No, but pretty often. The last time was about 2 days ago.
Have you ever required like sutures or going to the hospital for the cutting?
No.
Okay. All right. Have you ever tried any other coping mechanisms when you feel overwhelmed, like listening to music or going for a walk? Have you tried anything else when you feel overwhelmed and have that urge to cut?
No, nothing really seems to work.
Okay. Does anybody know about the cutting?
No.
No. Your mom doesn't know? Okay. All right. Any of your friends?
No.
No. Okay. Okay. Is there anything, I know you're using this as a way to cope and you don't have a lot of other strategies right now. Is there anything that you don't like about this cutting? Is there something about it that you'd want to change?
The scars, I don't really like how they look, so.
Okay. Okay. So in one aspect, it's helping relieve stress, but on another aspect, it's causing scars that you don't like.
Yeah.
Okay. All right. Couple more just history questions, Sierra, if that's okay. Is there any, I know you're taking Yaz. Is there any possibility that you could be pregnant?
No.
Okay. And I know Dr. Hellier asked you some physical questions, but have you noticed that you're having any like extreme fatigue? I know you're not sleeping well, but do you feel extremely fatigued or dry skin or hair loss?
No.
No, nothing like that. And your menses are regular?
Yeah.
Okay. How about experimenting with smoking? Have you ever tried smoking?
No.
No? Okay. How about any alcohol? I know you're 16.
No.
No, you've never experimented with alcohol. Okay. Any illicit drugs?
No.
No. Okay. All right. So we have the change in your mood, and we have that you've started cutting recently, but no suicidal thoughts.
Right.
Correct? Okay. And one other question I want to ask is in terms of your mood. I know it's been lower for the past 2 months, but in your history, have you ever had periods of an elevated mood, like that was really happy, people around you, like your mom or your friends, noticed a difference, that you were like euphoric, or
No.
that you had days where you didn't need sleep? No. Okay. Okay. All right. Do you have, I know I'm bombarding you with questions. Do you have any questions for me about anything?
No, not really.
No?
No.
Okay. How do you feel? I mean, this is, Dr. Hellier said you've not had any treatment before with mental health. How do you feel? I'm going to go out and speak with him, but how do you feel about maybe coming back next week? I know that we're going to probably have to talk to your mom, but how do you feel about coming back next week and, further talking about your mood and maybe kind of exploring some of the ways that you can use other ways to cope with when you have the urge to cut and feel overwhelmed?
I'd be okay with that.
You'd be okay with that? Okay, because like you said, on one aspect, this is something that you don't like because of the marks and the scars, right? Okay. All right, well then let me run out and speak with Dr. Hellier and come up with a plan of attack. Does that sound reasonable? Okay. All right, thank you.
Thank you.
Thanks, Dr. Hellier, for asking me to see Sierra Lewis.
Sure.
After I assessed her, I did make a diagnosis of major depression. She scored a 10 on the PHQ-9 scale.
Okay.
And so at this point, because her depression is present and because she has started cutting in response to a breakup with a relationship, I think that cognitive behavioral therapy would be a good place to start. So I do plan on seeing her next week to start
good.
cognitive behavioral therapy, and we'll start with that and see how she responds, and may need to consider an addition of a medication, but we'll just kind of take it week to week and see how she does. Okay, and from at this standpoint, I really don't feel that there's any mental health contraindications to her getting her driver's license. So if you're okay with signing off, I feel that there's no contraindications from a mental health standpoint.
Well, good, very good. Thank you. I appreciate your diligence.
All right, thank you.